Fourth International Conference on Public Health in Africa, CPHIA 2025, is taking place in Durban from 22nd to 25th October under the theme Moving Towards Self-Reliance to Achieve Universal Health Coverage and Health Security in Africa. Co-hosted by Africa CDC and the South African government in collaboration with AfricaBio's 8th Annual Bio-Africa Convention, the conference brings together leaders, policymakers, researchers and youth to strengthen Africa's health systems and reduce dependence on foreign aid. It also sets the stage for the G20 Health Ministers meeting under South Africa's Presidency in early November. Joining us this morning to discuss the conference and its implications for the continent is Linton Mchunu, Senior Advisor on Human Capital and Institutional Development at the African Union Development Agency-NEPAD, or NEPAD. Linton, thank you for joining us this morning. How are you?
Thank you. I'm good, thanks. And good morning to your listeners and good morning to your viewers.
So at the CPHIA 2025 or CPHIA, we're seeing Africa step up as a global voice on health rights. How is NEPAD positioning the continent as a defender of sexual and reproductive health and rights, as well as gender justice, as some global north countries roll back these rights?
Thank you. Yes, indeed, as the African Union Development Agency, we're proud to be also participating in this very important forum that's taking place in Durban at the moment. And of course, as you correctly said, in the recent past, we've seen drastic policy shifts, particularly from the global north as it relates to the subject matter. And this, of course, has been exacerbated by massive funding cuts from, whether it be the traditional funding partners in the north or the west. And of course, this has slowed down a number of critical, health programs or Africa's health agenda in its entirety, which does not only affect SRHR, but also affects, the entire health spectrum, whether it's HIV/AIDS or other related health matters. So as the African Union Development Agency, of course, we're pushing the agenda for domestic resource mobilization. So we begin to support and fund our own health agenda on the continent. And in this regard, we are aggressively driving catalytic health programs, including our programs, which I'll talk to a little bit later. But of course, also in line with our mandate, we're working with member states and regional institutions or regional economic institutions, which serve as the building blocks of the African Union to really strengthen them in terms of driving, the health agenda as it relates to SRHR. Because in Africa, we have to deal with these challenges. We still have, high numbers of gender-based violence, and femicide. We still have challenges around teenage pregnancy, and notwithstanding that we've made some progress on HIV and AIDS, we still have some challenges in those areas. So we have to continue supporting this, Africa's health agenda, and effectively also address issues around SRHR.
When we say Africa owns or Africa should own its narrative, what does that mean in practice when protecting SRHR from family planning to adolescent health? You speak of teenage pregnancy as well, and against rising global conservationists.
Yeah, so effectively, we have to take charge of our own development as Africa. For far too long, our development has been decided on externally, outside the borders of Africa. And this is why, through Agenda 2063, we have all coalesced around the Africa we want, and we are creating our own destiny and our journey as Africans, towards this Africa that we want. Now, this ambitious plan, of course, is premised on finding African solutions to African problems, and healthcare is at the center of Africa's development, as you would know. Now, during COVID-19, you would recall the spotlight was really shone on our low healthcare capacity and a heavy reliance on external supply chains. And at NEPAD, we established what we call Homegrown Solutions Accelerator, which is aimed at strengthening Africa's pandemic resilience and, of course, unlocking the potential of many local products and services that address major gaps in our health system, including maternal, newborn, and child health. And since we started, we were able to accelerate and process through just over 39 local products and institutions into the market. And similarly, earlier this year, we launched the 24 medical products for local manufacture in Africa plan. And you can imagine that Africa imports north of 75 to 80% of its medical products, depending on which part of the continent you're in. And we now have decided that on the African continent, we have decided that we have 24 medical products that we believe can be manufactured in Africa. And we're working with local manufacturers across the continent to strengthen their manufacturing base and begin producing our own medicines at scale to service the African markets. And I'm happy to share with you that over 67% of these products are specifically for maternal, newborn, and child health. Whether it's oxytocin, whether it's misoprostol, magnesium sulfate, anti-dehydrals, and rotavirus vaccine, amongst others. And this will ensure that we provide greater access to quality, safe, and affordable medicines to the African market without external dependencies, especially in clinics and healthcare facilities in rural areas. And by extension, of course, this includes family planning and other commodities.
Ministers are also unified, ministers around the departments of women's, children's, and adolescents' health by the Global Leaders Network. So, how will this political weight translate then into continent wide protection of the SRHR, especially amid global setbacks and rollbacks, rather, in funding?
Thanks. So we're working closely, of course, with the Global Leaders Network, which is championed and led by His Excellency President Ramaphosa. And we work very closely with him to ensure, and the network itself, to ensure that we institutionalize women's, children's, and adolescent health. Of course, what we want to do is really depoliticize it and ensure that it becomes a standing agenda on the African Union, at the African Union agenda. And I think we're close to reaching this reality because we have to understand that sexual and reproductive health, and by extension, maternal, newborn, and child health, are the foundations of health equity, particularly for women, youth, and children. And when we address SRHR, we strengthen the entire health system, particularly primary healthcare. And of course, SRHR is also a key pillar to universal health coverage. But most importantly, I think maternal, newborn, and child health outcomes is a critical development indicator and reflects broadly on education, gender, and equity and social development of any country. And so to realize this, you need political will at the highest level, but also strong leadership. And this is primarily what the leadership of President Ramaphosa through GLN and of course our CEO, Her Excellency Madam Nados Bekele-Thomas is doing. They're really galvanizing support for heads of state and ministers of health and ministers of finance, of course, to rapidly drive the primary health care agenda and universal health care agenda and realization, at least of which SRH is a key pillar.
Linton, thank you so much again for your time and all the best for the rest of that gathering, and have a great rest of your day.
Just before I go, I must indicate that how we drive some of these key initiatives, and of course work primarily with GLN, is through a program that we've just initiated around the African demographic dividend and sexual reproductive health. We've invested $100 million into this program over the next 5 years, where we are assisting in terms of high-level political advocacy, policy advancements, and of course making sure that we strengthen Africa's health system across the African continent and with the REX. Thank you.
Thanks so much. Linton Mchunu is Senior Advisor on Human Capital and Institutional Development at NEPAD, sharing insights from the CPHIA 2025 and Africa's push towards self-reliant, resilient health systems. That gathering happening here in South Africa in the province of KwaZulu-Natal. An interesting surname to have in this time of things in the Madraga Commission. I'm sure he gets questions, Linton.
All the time,
Okay, never mind. It's 8 o'clock.